All right. Thanks everyone for coming. So I'll be giving a couple talks on the FHIR Genomics Pilots and then talking about one specific application, the Smart on FHIR Genomics Server. So, I mean, there's a lot of interest recently, and certainly in precision medicine. And one of the important things to keep in mind in precision medicine is that it involves taking into account individual variability in genes. And in the FHIR pilots, that's kind of our interest area in terms of how do we enable precision medicine at the point of care, right? So if we look at clinical genomics today, it really involves, for the most part, PDFs, these portable documents, or paper reports. So it's often maybe not structured, it will not be encoded, and it will not be really usable beyond just its initial first sending from the laboratory itself. So what we wanted to do was to have an ecosystem that allows for clinical genomic apps that include genomic information both at the EMR and at the laboratory and sequencing vendor locations, so that you could actually access and integrate clinical and genomic information. You could make an order for such information. You could get back reports of such information. And the whole FHIR Genomics effort, which is really a subset of FHIR in terms of a number of profiles and resource that the clinical genomic workgroup works on, are modeled to work with certain use cases. So these use cases were defined in the domain analysis model document. And these are just a few of the use cases listed here, but these were the use cases on which the specification was formed so that it can support these use cases that exist today. And then the other way that it was kind of designed was with these layers of abstraction. So there are a number of layers, some of which were adopted in DSTU version 2 and some that are now just approved for the ballot for STU 3. And they go in terms of increasing levels of abstraction in terms of what type of data you may want to send. So the first level is very easy to implement with existing FHIR resources and structures, such that you don't have to really make many changes to current systems using LOIN codes and so forth. And the IOM pilot that was talked about yesterday from also from Boston Children's in the group involved the IOM digitized pilot, right, for pharmacogenomics. And as you go deeper, you're able to include deeper levels of information, including sequence-based information, exome-based information, and so forth. And you have to adopt more profiles and resources as a result of that. So just kind of a really quick overview in terms of the technologies. We're kind of at the intersection between SMART, which looks at system security and apps, the G4GH, looking at the sequence data sets that we may want to compare our existing patient to, and of course FHIR, which allows us to represent and communicate all this information. So I think really the FHIR Genomics effort and Smart FHIR Genomics and the pilots, everything kind of started probably around July. There was a paper that was cited that was basically the DSTU2 version of FHIR Genomics, the genomics part, and it was cited by an ONC committee, and they were interested in having some pilots, and so we decided to go about doing that. And there are now over 20 organizations involved in such pilots around the world. This is a listing of some of those, and I'll go through a few examples here as time permits. Another area that has led to kind of increased adoption in terms of these pilots has been the NIH came out with an RFA for one of the largest NIH grants that I've ever seen come out, the Precision Medicine Initiative Cohort Program, and in there they mentioned needing to use standards and listing Smart on FHIR Genomics as one of the ones. So that's kind of led to some adoption there. And then finally, the Institute of Medicine, now known as the National Academies of Medicine, had some rules and committees that decided on these couple of rules to do pharmacogenomics, and you saw an example of that yesterday. as well in terms of FHIR Genomics effort to carry out that at Boston Children's. Finally, this article, which was published, looks at cancer, and it was in journal, looking at the Journal of Oncology Practice, seeing how FHIR and FHIR Genomics and Smart on FHIR is being used, and you can see it's kind of spreading out to these different organizations. And another one of the pilots, the family history one, was talked about yesterday by Brett, and that's highlighted here. That was it says here the Kevin Hughes risk apps. I'll be talking just briefly today a little bit about the Vanderbilt Precision Cancer Genomics, which is also in this slide. So there are a number of different apps right now that are either in development, available, or in testing. These are a couple of them. One looks at diabetes, juvenile diabetes. Another one, precision cancer medicine, which I'll talk a little bit about. And then there's the idea of having genomics as a module that you could fit inside of other apps. And you can kind of see that down here with the arrow. That's a module that fits into the larger app where you want to add genomics to an existing app. So just as a quick overview on one of the apps, the Precision Cancer Medicine app done with Vanderbilt University and Jeremy Warner. The problem is that there are many rare somatic mutations that need to be looked at, and you want to compare your patient against other patients to know what treatment you might want to give, how others responded to treatment when they had those particular rare somatic mutations. And so this particular app was built to do that and actually tested on a number of physicians over at Vanderbilt. And that basically compared you as an individual to other individuals that had similar different mutations, so you could see how your patient is in terms of their genetic profile. A number of these apps you can either learn about more or get links to them by going to the gallery. That's the Smart Gallery. And just, as a quick overview in terms of, a lot of people may wonder, genomics, is it, where is it used today? And there are a number of different areas, whether it be genetic risk prediction for germline mutations, or we can see through studies like this where we have evidence where people will give different chemotherapy regimens depending on whether or not you, for example, have a particular EGFR mutation. Certain types of regimens will be given and others will be chosen depending on which type of mutation you have. And so this is being used actively today. And so these apps basically allow us to capture that and present that information. Another example is the precisionFDA. I was over in Washington last week and had another meeting, but met with the FDA, and they're very interested in a particular use case, which is looking at sequences and seeing if you have a genetic test that involves doing sequencing, how good of a quality is that sequence? Because the sequence could have many, many bases in it, and it's really hard to know whether or not, what quality is it unless you compare to a gold standard. And so they have a cloud-based system, precisionFDA, that compares the output of your test to a known gold standard sequence, and then you get a rating based on that of how accurate and different quality metrics. And so one of the things that FHIR Genomics has are these quality metrics that you can export. And so they're looking, well, they've committed to essentially adopting the FHIR Genomics standard as a way to communicate that information so that you can actually use it in an app. So you would have a genetic test, and the genetic test company would put that in the precisionFDA cloud, and then the cloud exports that using the FHIR Genomics API to an app that can be used by a physician when they're deciding to order a test to know if there's certain quality metrics are established in the regions that they're looking for. And you can see that this becomes much more powerful once you get a number of other players involved. So another one, for example, the National Marrow Donor Program is one of the ones that's building code already and is participating in some of the connectathons. And so once you have other genomic labs and other organizations that have sequence-based information, and you have this whole ecosystem that can develop from that. So that's kind of a very quick whirlwind tour of some of the initial pilots, and then I want to go to in the next part to talk about the Smart on FHIR Genomics Server. So that's this part. So basically, the thinking in the Smart on FHIR Genomics Server is that you have is to think about how people have dealt with large data that some of which goes into the electronic medical record system and some of which may not, like imaging, right? In imaging, you don't store the actual raw images in the electronic medical record, but you do store some of that metadata in there. And so we thought about that and how we could translate that into kind of a genomics archive computer system, kind of like a PACS would be for imaging, where you have some of the raw genomics data on site available if you need it, just like the DICOM images, actual raw images, and then metadata in the electronic medical record. So both of these use FHIR and FHIR Genomics, and I'll show you that in a couple slides. But again, this overall theme is that you've got the electronic medical record system that communicates with the sequencing lab to communicate the genetic information. And the actual genetic server can embed in it other information, whether it be links or knowledge resources, such as pharmacogenomic databases. It could have patient genomic data. It could have external information, and that can communicate with apps that also communicate with the electronic medical record system, whether it be an individual app or, as shown here, a module inside of another app. And this is kind of a more in-depth view of that, where we see how the workflow might occur. So you can see that you would start first with the EMR system, which has the Smart on FHIR EMR, and inside it is part of FHIR. It has, of course, the FHIR Genomics underneath it. And a physician would make an order using, for example, an order app, and they could order then from a genomics lab, which may be in-house or it may be out of the institution. And that would have it separate, and that's what this kind of part of the talk is about, the Smart on FHIR Genomics Lab Server, which has services to provide that raw sequence information, as well as links to repositories such as the Global Alliance for Genomics and Health, the GA4GH, for that raw data, which you don't want to encode in the EMR because it's so large and is not often used clinically, but you want to be able to refer back to it for quality and other metrics. So once you have that, you're going to have a response, and that response will include some of that metadata that you want to capture in the EMR and or want to communicate with that endpoint, that app, which is going to be used at the point of care. So, the next point is, looking at Smart on FHIR Genomics, what are the kind of the elements of it? So there's sort of some general features that we adopted, of course, from the Smart on FHIR, which includes, the FHIR clinical profiles aligned to meaningful use, the patient record scope, authorization, some of the authentication, and UI integration. But then there's the genomic-specific features. Genomics being directly integrated into the clinical model in the FHIR Genomics. Profiles based on standard FHIR resources like observation, family member history, and so forth, which enables the EMR to obtain the genetic results, both the non-sequence kind of traditional genetic tests as well as genomic sequence-based information. And finally, still the ability to have search-optimized raw data that you can access. And as part of that, we have a server and system that is kind of, like I mentioned, like the PACS system. We call it the JAX system, which integrates all that raw data so that it can be queried. So I think we're ready for video number 0 here, which just shows an example of how you might place an order. This was an app actually built as part of the Connectathon in January. It's being enhanced now. So you go picking out, a particular thing that you want to order. In this case, I believe it was either an HLA or a blood test, and you'll get then a result that you can report. So I think we can just, in the interest of time, maybe go to the next one. Yeah. And the next one is to, and we can play that video too, is basically the ability to log into a portal that allows you to see some of the genomic data and see how it may relate to pharmacogenomics. Again, this is at the lab server, so then you can see different reports, approve them and so forth, see diplotypes, look and scan around the genome. This is a genome browser here. You get information about it. And also compare your actual bases in your DNA with the 1,000 Genomes Project or any other external database. And that was a graph that we just passed a little while back there. All right, so let's go to the next slide. And then we have one more video here, I believe. Yeah, here we go. Where we can see some information links as well. So, and then in this one, we also show how you can, for example, link into like a CDS support system, for example, and actually, based on the dosage, pick out a particular, there's a particular clinical information that's presented there. So that is basically a way that you can connect the genomics server to actually when someone is prescribing something at the point of care. Let's go on to the next slide, which shows information links, so you can get a report as well as information for additional information about the genes that you're looking at, so, and also some clinical information that's derived based on that. And then we've got our final video, I believe here, the Genomics Advisor, which is more of a point of care application, which is once you first order those genomic tests, before you even prescribe anything, you may want to share that with the individual. And so you can actually do that and actually present information to them. All right. I think, do we have one more video or? Yeah, this one. Yeah. Okay, so I can show here, this is also this particular app was actually, if you can't read this, is because it's actually in Chinese, except for a little bit of text at the bottom. But it just shows an example of how you might see this information. Some organizations in China were interested in this. They're really interested in an open source kind of EMR framework for genomics, and so they translated this app. And you can see, for example, in that upper corner with the bars, that it shows you different risks for having certain types of conditions based on your germline genetic risks. And then on the left here, it integrates some clinical information so that you, at the point of care, a physician could talk to a patient about that. All right, so then just wanted to say that there's a website where you guys can check out a lot of the work that's been going on, both pointers to the actual specification on HL7, and it shows kind of there how all the different profiles and resources are linked together, as well as some documentation and kind of information that is now going into the specification that describes the different use cases, a tutorial that we did, and as well as a reference server that you can try online, or you can download a virtual machine and try that on your own, including all the source code to the server, kind of as with a sandbox environment. So you can use that to try out and create different apps. During HL7, we often have a tutorial actually where we create an app, and so we just basically give out all that source code so you can try that out, and there's a website for that. So I think I'd like to end there and thank everyone, and then we'll go from there. Okay, thanks.